Good evening, everyone. Good evening, everyone. We are about to begin the regular meeting of the HRC. Let's begin with roll call.
Commissioner Bacchetti?
Here.
Commissioner Chen?
Here.
Commissioner Ezrin?
Here.
Commissioner Morin? Commissioner Onan?
Here.
Commissioner Savage?
Here.
Commissioner Stone?
Here.
All right, thank you. Are there any agenda changes, requests, or deletions? I think we are good there. All right, let's move on to, are there any oral communications from the public? No cards? All right, so there's no oral communications. And then let's move on to item 4, which is approval of the minutes. We received the minutes in our packet. Does anyone have comments or changes to those? Or does anyone want to make a motion to approve them?
I'll make a motion to approve August 30th minutes.
A second.
All right, all those in favor say aye.
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 Opposed or abstained? Okay, the August minutes are approved. Is that our only set?
There is September.
On the September
I'll make a
ones.
motion to approve the September 12 minutes.
I second.
All right, all in favor?
Aye.
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 Opposed or abstained? All right, the September meeting minutes are also approved. My goodness, we finally got some approved and out of the way. That's awesome. Thank you, Amy. All right, so now let's turn to item 5, which is our business items. And the first agenda item we have tonight is a continuation of our housing learning series. And tonight we are going to have a presentation from Envision Shelter Network. Minka, did you want to introduce our speakers?
Sure, I'm pleased to have 2 members of the staff of Envision Shelter Network, Mila Zilka, which is Strategic Relations Director, and Philip Daw, who is the Program Director at the Palo Alto site. So we'll welcome you both here to the table. And
Sure. We brought some updated materials about our agency in general. So,
Thank you.
and if the public would like that information, I can make that available. Well, thank you so much for having us. We're going to actually start with Philip talking about what we're doing in Palo Alto, and then afterwards I'd be happy to talk about our agency overall and what's happening with Envision Shelter Network in general.
Thank you very much. I'm sure I know all of you here except Mr. Stone. So welcome, sir. So as you all know, we are staff of Envision Shelter Network, formerly Envision. Roughly about a year and a half ago, we merged with Shelter Network up in on the peninsula in San Mateo County. But Envision had been in Palo Alto for 7 years prior to the merger with Shelter Network, and so we were the only local service provider as far as homeless services were concerned for all this period. So we are the organization that runs the food closet right down by the All Saints Church. We are also the organization that operates the Hotel de Zinc shelter, which is the only homeless shelter in Palo Alto, now maybe in the northern Santa Clara County. We are also the agency that operates the Opportunity Center, which is the permanent supportive housing program in Palo Alto with support services. We also are the only agency in Palo Alto that provides emergency assistance to Palo Altans when there is a need. We also operate the only clothing closet and the only meal program, congregate meal or sit down hot meal program in Palo Alto. And so our services are pretty wrap around. We just want to make sure that there is one stop where folks who are homeless within Palo Alto can access all these services. The goal initially was to make the Opportunity Center the hub of all these services, but unfortunately we are not able to centralize all our programs there, and so currently, or since then, they have all been scattered within the Palo Alto community, and they are in proximity of transportation or VTA line, so it's easier for our clients to go to. Our programs, they are running smoothly, but they are all financially strapped because of the burden of clientele that is on those programs right now. For instance, the Breaking Bread and the Hot Meal program, the Food Closet and the Hot Meal program, there is a big toll of different folks that it was not meant to serve accessing those services. So in the last few weeks, we had to make some changes to the Food Closet, where folks who are not in danger of losing their housing or at risk of becoming homeless will not be served. And so we did send letters out to our clients. There were a lot of folks who were taking advantage of the free food we were giving out. And so folks who were actually homeless would come in during the day and not be able to receive anything because the regular folks who were able to get there had gotten there and taken all the food. And so if you hear any issues going on that the Food Closet is not serving Palo Alto, and that's not the truth. The truth is that we are going back to our mission to serve the folks who are vulnerable and need those services, the mentally ill, the real true homeless who are living on the street, and some folks who might be at risk. I want to talk a little bit about the Opportunity Center. It is a one-of-a-kind program in the country, and we are lucky that we have it in Palo Alto. It has 88 units of housing. All of those housing units are permanent supportive housing. They are not transitional housing or shelter programs, so you cannot stay there for 3 days and move on. You have to sign a lease agreement and live at the Opportunity Center. I'm sure you all know the history of the Opportunity Center. When Envision, before it became Envision in Palo Alto, we used to be the Urban Ministry of Palo Alto, and we operated right behind the Red Cross building in front of their garage half of the day, and did half of our day at a church. So the good people of Palo Alto got together and decided that it was not a decent place to serve homeless folks. So Community Working Group and the city and a host of other folks came together and built the Opportunity Center. Envision was contracted to provide the social services. And so there are 3 organizations who operate out of the Opportunity Center. Envision being the social services provider. There is Peninsula Healthcare Connections, that is a healthcare primary and psychiatric healthcare clinic that provides their services to our clients in the community. And then there is Charities Housing, who are the property managers of the building. And so the goal is that Envision, Peninsula Healthcare, and Charities Housing would house people, and we will make sure that they stay housed. Since the Opportunity Center opened in 2006, we have had more than 200 people live at the facility. There is currently about 70% of the folks who have been there from the get-go who are still living there, which is a huge success for us because in my experience, a lot of the folks who are on the street or used to be on the street because of their mental health or other circumstances, they could not keep one address for a very long time. And when I was a case manager at the drop-in center, I saw that firsthand. We would go on Craigslist, find housing for people in somebody's room or somebody's shared housing, and they would interview well with the landlord because at that time their mental health was not manifest yet. And then within a day or two, I would get a phone call saying that you need to come and remove this person because they're screaming in the middle of the night and doing all this. And so those guys became homeless again immediately. But with the Opportunity Center, the problems are not gone, but we are able to contain the situation there because that's what the building was meant for. There's a clinic right downstairs so that if we have mental health issues, we can refer the clients to go see a doctor. If somebody is screaming and shouting and doing that, the property manager cannot automatically evict them. They have to go through an eviction process, but they give social services a chance to address the reasons why the eviction is taking place so that we can try to save their housing. And there are some that we couldn't save because they were not ready for housing. And so there has been a few evictions, but the brighter side is that a lot of those folks still live there who would otherwise be homeless. But our drop-in services is one of the biggest services we provide because we feel like there's not enough housing, low-income housing in Palo Alto, and there's a lot of folks who are homeless living on the street. So the drop-in center has become a community for those folks to come in and hang out. Instead of hanging out on University Avenue, they can come there, they can take a shower, they can have a locker to lock their personal belongings in, they can have food to eat. We serve coffee, and we're supposed to serve snacks, but they tend to be meals because we get donations from Whole Foods and Trader Joe's that are ready to eat. And we provide intensive case management to the folks who are there. We provide them with bus passes. We operate our hotel design program case management from there. So our clients who are in the shelter have to come to the Opportunity Center once a week to see their case managers. And through that, we are able to put a lot of the folks in housing. In fact, I just did a report for Community Working Group, and Ray will see it tomorrow. So I stated somehow, yeah, I'm sure you have. I stated some of the drop-in clients. This quarter, this past quarter, July to September, there were 10 people that found employment through case management. We had 4 people apply for Social Security benefits. There were 8 people who found permanent supportive housing, and 18 new people went into hotel design program. And so with the type of population that we serve, it might seem like these numbers are very low, but it's a huge success for us to even get one person into permanent housing. And I had said in the past that there are no low-income housing in Palo Alto, so we have been, the agency has a person who finds housing. What do we call that person?
Oh, I don't know.
So they find supportive housing within the county or outside of the county for folks depending on their income. We have contracted with John Helwani. I don't know if any of you know him. He used to operate the Palo Alto Hotel before it was sold. He has properties in right across the border in Menlo Park. They're called Atherton Court Hotel. He has about 60 units. So we rent 32 of those units as supportive housing with case management. And so a lot of our clients from hotel design or drop-ins or anybody who is our client who needs permanent supportive housing, if we have any of those units, we are able to take them there. So as we speak, we have 20 individuals who live at Atherton Court apartments in Menlo Park, right across the border, who receive case management from us because our staff goes there, depending on the appointments they have to go and support the clients. One of the biggest things that I'm very proud of at the Opportunity Center is our ability to work with the Stanford Law Clinic to provide Social Security benefits to our clients. I can guarantee you that if you and I applied for Social Security on the basis of disability, we probably would not be able to navigate the system because it's very bureaucratic and very difficult to do. So you can imagine what our clients who are really mentally ill have to go through. And a lot of them have done it in the past, and automatically when you apply for Social Security, they will turn you down. It's one of the things they do. And so when you get turned down, there is no way of going back. As far as our clients are concerned, they don't want to try again. And so in the past few years, we have had this wonderful partnership with Lisa Douglas. She's a professor at Stanford, and the project she runs is basically Social Security Disability Project, and their goal is to apply for Social Security benefits for homeless people or people who qualify. And so she has a bunch of kids, students who do that, and every Thursday they meet in my office. We find clients for them. We know the clients that qualify and are not receiving it, and we hook them up with the students, and they apply for these benefits. And so far, they have had about 60 cases, and not a single one of them has been denied, and all of them have gotten benefits since 5 years ago when they started this program. And that is the reason why we've been able to move some of these folks into vacant units at the Opportunity Center or Atherton Court or even motel rooms. And so,
What does it mean to get SSI?
So there were two, SSDI and an SSI. Is that the question? What is it?
SSI and is it SSDI?
So SSDI is the permanent disability for most of it, and SSI is the short-term disability for some of the folks, like when you are out of work and you can't do anything because of Yes.
When you get those benefits, what do they amount to?
It depends. Sometimes it depends on how much you've paid into, but as far as our clients are concerned, the maximum they can get, or the average that I have seen, it's $875 a month. Yes. So as you can tell, that is not enough to rent any apartment or even a room in Palo Alto. And so,
Do they also get eligibility for Medicare?
yes. Yes, they do.
But is it a condition on having worked before, or?
No.
No.
No, it's not conditional having worked before. SSI is on condition of having worked before, and then that's when you pay into it, and then you get a certain amount of money based on what has been paid into. And so that avenue has been one of the greatest that we have explored and have been able to use, because the big challenge has been, well, even if we find housing, where are we going to find the money to pay for somebody to go into housing? And so one of the case managers, what they do is that once you come in and we identify you to be disabled, the first thing we do is to try to find an income source for you. So we start with general assistance through the county, and then that is a short term, that is easy to get. And while you're doing that, we put you on the disability track, or we put you on an employment track if you can actually work. And the employment track has been great. We found housing, I quoted some numbers here. Some people found housing, seasonal work. We found work for them. And also some of our folks joined the Downtown Streets team, who also meet at the Opportunity Center on Thursday. So there is a multi-faceted approach to solving some of our programs from the drop-in center. And another piece of the Social Security application was that when Community Working Group completed the building of the Opportunity Center, they had some money left that they put into an endowment. So they asked Envision to administer that fund, Envision Shelter Network to administer that fund in terms of housing subsidies for homeless folks who have been identified as disabled but do not have any income. And so initially in 2006, we put 25 people who had zero income into the Opportunity Center units and paid their rent for as long as they were working with the case manager and working with the Stanford Law Clinic and the medical professionals to apply for Social Security benefits. And so it took some 3 years, 4 years, some of them 6 months, a year, for them to receive their benefits. So once they received these benefits, the subsidies were taken away and given to other folks who needed it. And currently, all those 25 people have all gotten incomes and are on their own, responsibly paying their rent. And I only have 11 folks on my subsidy list, and these are people whose incomes and rent, there is this much difference. So they're still on subsidy, not because they don't have the income, but we are trying to help them with as much as we can to be able to maintain their housing. And so the subsidy program and the Social Security program has been very key for a lot of folks to maintain their housing. And if it wasn't for that, most of the folks in housing would probably be back on the street because they could not afford their rent. I want to talk just a little bit also about the Hotel de Zinc program. As you may know, Hotel de Zinc is the only shelter north of Santa Clara. There's not any other shelters. It's only for adults only. It sleeps 15 or 18, up to 18 a night, but we tap it at 15. And it's a shelter that rotates from church to church. So there's 12 different churches that host our programs, and there's one in Menlo Park, and the rest are all in Palo Alto. It's a community ownership type of program because the folks at the church, our host churches, provide us with the rooms that they sleep in, and also the dinners they eat. But we have to fund the staffing and the case management and everything else that goes with the program. And in the past, it seemed as if it had been like a frequent flyer thing for folks to wait and just go in and not do very much. But it hasn't been the case in the last couple years or so. A lot of our graduates from the program are actually moving into permanent housing or finding work jobs. And the difference, I believe, has been the motivation for most of the folks that we are bringing in. So if we find out that, and also the resources that have become available to us in the last few years, the collaborations we have, so that when somebody comes in and they can work, we know that we can apply for Social Security for them. And in the past, those avenues were not there. We didn't even have the funding to hire somebody to do that. And so the graduation rate and the successes have been very good. And a lot of people who would otherwise not go into Hotels Inc. are now applying to get in. So we have a long waiting list of folks who are going in. And we think that that is a program that should really be supported by.
I was at the First Presbyterian Church, Hotel the Zinc, in July.
Yes.
Because I supply meals for them one
Yes.
day. And then I was heard that I was there looking for them. There were only 4, and maybe I was too early. Okay, and then I think the church allowed 15 people, but there were only 4 in there. And they told me, they said that the numbers were lower.
Well, maybe you were a little early, but I can also tell you that in the summer, the numbers can get lower, but not anywhere near 4.
And can I want to also, perhaps you spoke to Joy Slizer or Gail Thompson. They raised that issue with me, and I went back and looked at the attendance records, and we did find that it ranged from 13 to 15 each night.
Okay.
It's just that there are people that are working, and so they might come in after the meal time, because it really is a short window for
Okay.
people to eat at 9:30 and then
That's
lights
right.
out.
I was real early. I brought food in there, and then I had to do something else.
Right, so that was brought to my attention, and I looked into it, and I've since told Joy.
And it was amazing. There was one person, and she brought her own food.
Yes.
Well,
I'm familiar with First Press, so I just want to follow up a bit, which is, I don't quite understand, which is, I know there's a hallway where you eat, but is that, my understanding is you're saying that they sleep there as well?
yes.
I'm sorry. My understanding is they have a few trailers in the back parking lot, and they sleep there.
So our clients at Hotel Zinc actually sleep in the churches. The churches give us a hall, and we have a trailer that has all our bedding, mattresses, pillows, and stuff. So every night we have to go and bring them in, so that after dinner people can set up their beds and go to bed. Unfortunately, our conditional use permit allows us to operate the shelter from 9 o'clock. From 9:30 when the clients get in till in the morning, because some of the churches have activities at night and children and all that. So once they get in, they have 30 minutes to 45 to eat, and they are ready to go to bed if you've been roaming the streets for a while. So, but again, also to answer some of the things you said, in the summer, our numbers at Hotel the Zinc actually does go down a little bit, but not anywhere near 4. It's because most of our guys realize that it's beautiful outside. I don't have to go indoors. I can sleep in a tent. I can do this, and then in the winter, the numbers jump through the roof. Yes.
I must say that I was, the church did a very good job. We were told specifically in detail what to make. Everything homemade. We cannot buy it from stores.
Yes. And quickly, I want to talk 1 minute also about our emergency assistance program. So all the social services agencies in Santa Clara County, most of them provide emergency assistance either through funding from their cities or United Way and other private grants within the county. And so Envision Shelter Network is the representative of the Palo Alto community, and it's all done by zip code. So for instance, if somebody calls us and says that, I need emergency rental assistance, we will find out, where do you live, where's your zip code, and if it's within Palo Alto, then that's our jurisdiction, and we are responsible for helping them. We only help people moving out of Palo Alto or helping people pay rent in Palo Alto. So for instance, if you live in Mountain View and you live in Mountain View to move to Palo Alto, the agency in Mountain View is responsible to move you here. But once you're here, then it's our responsibility moving forward. This quarter alone, we spent $3,800 in the emergency assistance fund. That is pretty much all the money we got, except another $4,500 or so that came through the holiday fund from Community Working Group for us that we're using. But when we get $3,800 for the whole quarter, we only get 3, 4, maybe 5 calls, and that money is gone. And these are good Palo. The stories that we hear through the emergency assistance programs are very heartening, because these are folks in Palo Alto who would get sick or have surgery and not be able to go to their regular job. And so because they run out of sick time and they don't have money to pay for it, when their paycheck comes, there is maybe there's a vacuum of maybe a week or 2 worths of income that is missing. And if they don't pay their rent, they're back on the street. But they have proved that, look, I'm going back to work, but this is the reason why. So those are the emergency circumstances where we have to go in and help people. And then if any of our homeless clients finds housing, they need the first month's and deposit to move in. Without that, you're not going anywhere. So we have to tap into that fund to be able to help these folks move in. And as many people as we have moving into housing, 3,800 really doesn't do it. So we have to scrunch money from everywhere in order to be able to put folks into housing. And so I just wanted to say that I've been coming here for years to beg for money all the time. But I just want to say that we appreciate your support, but there is a lot of work still to be done. I personally have always felt that I would like to have the whole group visit our programs. I know some of you have already done that, to actually see the impact that it's making on the community. We can talk about housing, everything, all you want, but there are some basic stuff that if these guys do not get, in addition to being housed, they can be back on the street immediately, and that is basic food, clothing, and shelter. And I felt that every time that I make the case here, it doesn't seem like it's the big deal, but I will tell you that when our clients pay their rent, those who are housed, they have nothing left. So if we don't have the food closet where they can go and get 2 bags of groceries twice a week, they have nothing. If we don't provide that meal every single day at different church locations, they will not have a hot meal. And there are folks like Gloria who are walking the streets. If we don't put them in Hotel de Zinc, they have nowhere else to go. So our programs might seem like oh, we know all this, but we need the city's support in order to be able to help these guys who most of them are actually from Palo Alto.
I would just want to embellish a little bit by standing back and looking at our overall agency. So we operate in both counties, from Daly City to San Jose. Our case managers have served about 6,000 people this year in the last 12 months. That comes to about 1,000 people a night that are sheltering with us. And so we have 18 facilities, and the Opportunity Center is one of those. And I think looking at the Opportunity Center, that was developed with a housing first model. And that's something that Don Barr has often talked about in the community working group. And it's a model that we practice in both counties. I think sometimes the talking points in San Mateo County sound a little bit different, but it's the same thing. We have relationships with landlords in both counties where we are trying to house the people who come to us. And if we don't have the housing, I think that's when we look at what we call the beyond the bed model. And that's where our case managers are doing intensive case management to educate and find jobs. So the education part is, how do you do a resume? How do you, all the things that go with getting the job. And if you're in crisis, well, everyone is in crisis in this situation, but if you have other things going on like drug and alcohol issues, addiction issues, or mental health issues. So, I'm even thinking about, this morning we were at an event where some landlords were recognized for having a house that houses people first, and our case managers work with the tenants in this house for 1 year, and people who are in the house are able to effectively improve their credit, their credit rating, so that when they are ready to apply for market rate housing, their credit score has been improved. So I think Atherton Court is nearby. Haven House is in Menlo Park. That's a family shelter. in East Palo Alto, we run what's called a Hoptel. It's for veterans. It's a play on a short stint in the military and the word hotel. So veterans who are receiving care at the VA are able to come and stay with us for, it tends to be for about a month's time with a resident manager in this house. And instead of being in their cars and going, trying to find friends or something because they've flown here from somewhere else in the country. So we have a lot of, in Mountain View as well, we have a graduate house that we have people housed at. So, even though us here in Palo Alto, we're connected with a lot of different kinds of buildings where we have housing first happening and beyond the bed case management happening. So I would encourage all of you, if you would like to take a tour, of course, that we would start with the Opportunity Center, but there's other facilities that we could show you just to have a conversation about our approach in general, because, whether it's Julian Street Inn in downtown San Jose, that's a mental health shelter, to the Vendome in San Mateo, there's a lot of different things that are going on with all of our different properties and programs. So really appreciate the opportunity to come and speak with you, and I guess we can open it up to questions.
Hi, yeah, thanks so much to both of you for coming tonight and presenting to us. I've already learned a lot. And I have a question, though. So one is that you mentioned Hotel de Zinc is only for individuals and not for families. So if a family comes to you in crisis, then what are their options for emergency housing?
That's a tough question that I'm actually dealing with two of them right now. There is a family there are two families. One of them, I got calls from the Palo Alto School District. The mom has probably about a year to live because she has brain cancer, and the dad and the three kids go to Palo Alto and they sleep in their car. So the school district called me and said, you need to help us because we've worked with them before. There is a unit that's open at the Opportunity Center, from what I hear from the property management a couple of days ago. It's a one-bedroom unit, but unfortunately, one bedrooms can take a maximum of 3 people, and this family is 5. So today I had to write them an email and say, I'm sorry, the property manager will not budge, and so you still have to sleep in your car. And so the short answer is that unfortunately, there is no family shelter in Palo Alto or even close by. What we have done in the past is we have Commercial Street Inn is one of our family shelters in San Jose, and also we have Haven House in Menlo Park that I would like to show you off. It's a beautiful facility. So what we've done in the past is when clients from Santa Clara County or Palo Alto come through us, we do the unthinkable and send them to the San Mateo County.
On the record.
Off the record. Send them to the San Mateo County program that we have, so that we can get some of these families off the street, because that is the only thing that is in near proximity, and it's the humane thing to do, because there is no family shelter. And when the children are involved, we have to keep them. And one thing that I want to say is San Mateo has they have it's an ordinance in their city.
No, it's the county supervisors passed sort of like a colleague's memo. It wasn't an actual ordinance, but it's an understanding
that they would not let any family with children sleep on the street, not one night. And so they have a funding, that motel voucher funding, that puts people in motels. And so that's what Shelter Network in San Mateo County does. So then there's a family that's homeless in their county. You automatically go into the motel voucher program. You stay there until there's one of our shelters opens, and we transfer you into that shelter. So that is a model that can be brought to the city.
And the motel voucher program in San Mateo County, clients typically stay there for an average of 2 weeks. So it's not a perpetual place to live. It's really seen as it's an emergency place until we can find a spot in one of our facilities.
So why doesn't Palo Alto have a similar program, or why isn't there one in Santa Clara County?
I don't think we can answer that. I mean, I think some of the council members are interested in looking at that.
Okay.
I think it's definitely it's a tool that this neighboring community has used, and I would encourage you to ask those county supervisors what their take on it has been. So, we administer that program, so we like it, and we think it's effective, but I would encourage you to ask them about it. So I will say that also in San Mateo County, there's a rotating church program that's very similar to Hotel de Zinc. It's called Home and Hope. It's different. I mean, it's similar in that it rotates from one house of faith to another, but it's different in that it houses families.
But there's only 4 families
Yeah.
each time.
So there's challenges and pluses as well. And so what I've been doing is I've been looking at Hotel de Zinc and exploring the idea of maybe expanding it if we have enough partners in the not just in the Palo Alto community, but in surrounding cities. And in doing that, I've been connecting with Home and Hope as well as Faith in Action, which is based out of Cupertino, because there are these rotating church shelters that do serve a purpose when there isn't housing. So while people are waiting for us to place them with housing first, we use our Beyond the Bed model for Hotel de Zinc and other emergency locations, and then there are these sort of friendly, colleagues that have similar programs on sort of the edges of these 2 counties.
And I just have to say that in as much as we believe in housing first, which we do practice because we have facilities all over the county, there is also that piece, which is the shelter, because you can't just take somebody from the street into housing. Some people might not be ready for so many different reasons that I've stated, income-wise or behavior or any of that stuff. And so those Hotel de Zinc, for instance, is a good place for some of our folks to start, because you can say, well, stay on the street for 90 days or 6 months while we find housing for you. You can go into the shelter and be treated humanely, have a nice sit-down dinner, sleep on a mattress, and enjoy yourself while you're there and build a community until you can go into housing. And so we believe that that continuum of care is very critical until you get into housing.
Okay. And Philip's modest, but it's really tied into the case management that happens at the Opportunity Center. So it is a requirement that people who are in that particular program come, as he mentioned, to the Opportunity Center for their case management. But it's not just somewhere where you show up at night and in the day you're gone. We're about transforming people's lives during the day as well, so.
No, go ahead. I have something, but
A few weeks ago, I talked to a homeless person, and he told me that because he had a criminal record, he couldn't get into some shelters, and no knowledge about the legal situation here or the practice here. Can you tell me, is that true? And if that's the case, what can people like him do?
So generally, as a rule, shelters don't concern themselves with people's criminal records when they do intakes. We don't, for sure. What we do is we check on Megan's list to see if somebody is not, we don't have a registered sex offender within the community, because they're probably not allowed to be there. And that is, we go online. If you're not on there, we don't check any criminal records at all. It's, to answer your question directly, it is not true. As far as I know, most of the shelters do not consider criminal records before you go into a shelter.
Thank you.
I missed a basic.
You need to turn it back.
I missed a basic issue in here, which is how long is there a time limit on, for example, the Opportunity Center?
No, the Opportunity Center is permanent housing. You can live there as long as you want, as long as you're paying your rent and being a tenant, and you and I can rent a room at the Opportunity Center. The only reason is we might not qualify based on income or certain reasons, but everybody can apply to live at the Opportunity Center permanently.
That's what I was wondering. I know somebody who's there, so I was wondering.
Yes.
And how many were they again? Did you say 80?
There was 88 units of
88,
housing.
yeah.
18 of them are 1 and 2 bedrooms for families, and then the 70 are what we call the single room occupancies, SROs. But some of those SROs have 2 people, couples living in them, friends living in them. So there was definitely about 135 total folks who live there. And thanks for bringing that up. I want to mention that there are also children who live at the Opportunity Center. I think currently we have 22 children who live there, and some of them came to us from some of our shelters. When we operated the Clara Mateo shelter on the VA ground, when the Opportunity Center opened, we brought about 5 families there. We brought some who had come to our drop-in center and moved into the Opportunity Center. Some of the kids have lived there since they were born. They all go to good school districts in Palo Alto. We have a dedicated 2 dedicated staff people who run the family support center at the Opportunity Center. One is a case manager, and the other one is the children's services coordinator. So all they do is this summer. I wanted to show you this briefly. I didn't bring copies for you. I just wanted to show you. These were summer camps that we did. We went to NASA. These were back to school giveaways that we did. And we had birthday parties. So the kids there, we want to be able to make sure that they feel treated right, especially when you go to the Palo Alto School District, and every summer some of these kids are coming back from Paris and telling you about their summer. The least you can do is have a summer adventure program, and sometimes it costs us anywhere between $5,000 to $7,000 to be able to put on a summer adventure program for these kids for 8 weeks. We have to rent a van or sometimes 2 vans. We pay to go to Giants games. We go to the boardwalk, Monterey Bay Aquarium, and these are all funding that we have to raise on our own to give these kids, something for the summer.
I'd add that, so my children attend Ohlone Elementary School, and at the end of the school year, their school did a bathing suit drive for this program, because children who are in this program, they might have clothes from the clothes closet to go, but they may not have a bathing suit to participate. And so just some simple things that we might take for granted for our kids, they don't have. So I know that the community at large participates in supporting this, and we have over 18,000 volunteers overall that participate in our agency programs.
So with someplace like the Opportunity Center, how many transition out? First of all, that would be based, I'm assuming, on income, which is if somebody gets a better job. Then is there a necessity that they move out, or is it just? There's
not a necessity that they move. Well, so technically, yes. If you make more than a certain amount of money, you cannot. When we do recertification, you might not qualify to live there. But fortunately or unfortunately for our clients, most of the folks who live there are on disability insurance. Benefits. So their income is not going to go through the roof all of a sudden. It's just going to stay the same. And so for majority of the folks who live there, this is it for them. They're not going anywhere anytime soon. The reason why some transition out is some of the units are Section 8 units. They are called PBA. They are portable units. So when you live in one of those units for a year, you get a portable voucher to move into Section 8 housing, and you pay 30% of any income you have, and the federal government pays the rest. And so there are folks who have found 1 or 2 bedrooms with their vouchers and have decided to move out, and they have been gone. There's some who still have vouchers and live there, some of the families especially, because they think that they would get better support for their children. They want them to still be in Palo Alto School District. They like the support that we give them with the summer adventure and all that stuff, so they would rather live there than move out. And so, yeah, a lot of people are not moving out on their own just because they are making a couple more bucks.
But then we do have clients who don't have disabilities and are on a track to becoming tax-paying citizens again. And so, for example, at Haven House, and I'd say overall, the clients stay between 120 to 150 days. So that's considered a transitional. That's considered transitional, and so there's a at that site as well. Anywhere we have children, we have child coordinators as well as regular case management. So there's after school homework help, and it's similar programs for the kids while the parents are in classes at night. Or filling out job applications and all of that on site. So, so there are other programs that we have where people are moving through and then gaining the skills and saving funds for first and last month's rent, security deposits, and then moving into market rate housing. Albeit it's not going to be market rate housing in Palo Alto, but they are able to transform their lives. So,
I got a question for you. I visited the
Sure, Mike on?
Opportunity Center last year. I saw there are medical services. They have doctors from Palo Alto Medical Clinic, and also they were talking about there will be psychiatry services there, and they had trouble getting somebody to take on as a doctor, psychology doctor. But anyway, I was wondering, the service, are they available for homeless drop-in?
Yeah, so the Peninsula Healthcare Connections is a different nonprofit, and I cannot speak for them, but I can tell you basically what they do. They provide primary health care and psychiatric services to our clients. And it's not just the residents and the drop-in clients, but to anybody homeless or low-income folk in Palo Alto who goes to the clinic. Yes, in the past there was a problem because the psychiatrist they had was through Stanford, came to us through Stanford, even though we were paying Stanford to have that gentleman work with us. And the cost of that was enormous. We couldn't handle it. So that contract was canceled, and another psychiatrist is in there right now, Dr. Fu. So he comes in, I believe, twice a week to see his clients based on appointment. But Dr. Patricia McGann has been the primary healthcare doctor through PAM, and she's been stationed there for a while. And sometimes we do get some students from Stanford. There are some collaborations who come in there, so there is free medical care. Yeah.
So Philip, I wanted to ask about the scenario for some of the homeless population that have been living in their cars, and of course there's a lot of controversy in the city about the new ordinance outlawing living vehicle dwelling. So if one of those folks were to show up at the Opportunity Center and say, okay, I've been living in my car and I can't live in my car anymore, what kind of options for housing do they have through you? Can you help those people?
So we can help them based on the services we have available. So if somebody walked in right now, they would be able to use the showers we have. They would have food to eat. We might be able to put them in Hotel de Zinc immediately because I made a promise earlier on when that scenario was playing out with the car folks that we would make special accommodations for some of those folks if they came. Fortunately, nobody has shown up yet, but I did reserve about 3 beds for Hotel de Zinc if that scenario played out. So we were going to be able to put them in Hotel de Zinc and give them a case manager. But as far as housing was concerned, it goes back to the same thing. We have to see what is your income, because housing is not free. We have to see, can you pay? How much do you have? And which landlord is even willing to rent their units? I believe right now we have more folks at the Opportunity Center who do have income but cannot get into housing than those who don't have income and want to get into housing, because the housing units are simply not there. The other big thing is that when our clients live when people live in certain societies for a very long time and they call that home, it's very difficult to even move them to the next town. We can't even get folks to move to Menlo Park. We have to move them with the promise of like, oh, you can come, you can do this, we're going to come and see you. We can get people to go to Mountain View because some of those folks went to Palo. This is their backyard. They grew up here. Their families are from here. And so they want to be able to live in Palo Alto. And so the difficult part is, how do we find housing units for them within the Palo Alto community? And it's not very easy. And so that's why we are trying to move some folks to some of our permanent housing sites in Atherton Court. Mm-hmm. So Unfortunately, we can give them the basic drop-in services with the case manager. You can get clothing, you can go into a shelter and all that. And then we can work with you to see if we can find housing for you. And it would not probably be in Palo Alto. It can be anywhere else.
Okay.
Throughout this conversation, the term case manager keeps coming up. I was wondering how many case managers, headcount and full-time equivalents, are at work in Palo Alto, working on working with homeless people.
So I can only speak for my program. I'm not sure how many other agencies have, like the Downtown Streets team have, but I have a family case manager who works full-time with families. I have 2 drop-in case managers and a part-time Hotel de Zinc case manager, and also works part-time at the Opportunity Center. So there is 4 case managers at the Opportunity Center, and 3 of them do drop-ins, and 1 Hotel de Zinc and part-time Hotel de Zinc.
And how many does Envision Shelter Network have working?
Overall, I don't know how many we have overall. I think we have like 140 program staff, but I think a lot of those are shelter workers. I don't know from the case management side.
If we could all have our druthers, how many case managers would we like to have?
So the norm at any program, the best practice is any 20, tops 25 people, just like any school classroom. Anything more than that is doing a little too much. So we try to make sure that everybody has at least 20 or so cases per person.
And their job is essentially to try and coach people and help them to go from wherever they're starting to independence.
So, for instance, if somebody walked into the Opportunity Center, what we would do with them is we'll just find out for the basic things we do, homeless prevention, shelter services, and acquiring of income, and mental health and physical health. So that will be the case plan that we would have for them. And of course, we will take into consideration what their needs are that we can work with them. So those needs are tailored specifically to every individual. But when you come in, these 4 objectives, homeless prevention and shelter services and acquiring SSI and mental health, are something that we're going to try to address with you when you come in. The difficult thing about running a drop-in center is that that's just what it is. It's a drop-in center. So if the person drops in today and they don't show up again, everything you've done is just went out the window. They will not come back. And so for us to be able to continue to do the things we do with our clients and maintain a relationship with them, we just have to, it's a slow process. We have to be friends with them, build their trust, for them to tell us what their problem is so that we can help them. We've had folks who've come to the drop-in center for a year and they don't want to talk to anybody. They just don't want to talk to anybody at all. And so with those folks, we're like, okay, we're going to wait till they're ready. But while you're waiting, hey, this is what we have. We have this, you have that. Do you have a locker? Do you want to take a shower? Do you want to do all this? Because we believe that people have to be ready. And we're trying to incentivize people also to be ready with bus passes and all those. And so it takes a while for these folks to feel comfortable and say that, oh, I want to go see this guy, to get a phone call, to call Social Security, and that's when those relationships start. So it might look like people are just sitting in the drop-in center not doing very much, but of course, there's not much we can do if they don't have the will to engage in case management. When we first opened the Opportunity Center, I believe everybody thought that it would be a center where every day there are groups going on. There's an AA group, there's this, We tried that, it didn't work. To answer one of your questions, I brought Juliet Brody from Stanford. She's a law professor, and she used to run the, it's not a disability clinic, but one of the a criminal expungement record thing in East Palo Alto. So she came there. I got a group of people, about 15 people in a room, with the goal that we were going to expunge criminal records, start doing resumes, and try to get people help. She was very excited. She did her spiel and everything, and we had to reconvene in a week, and she was going to come and bring people to try to help folks. When she came the next week, there was only 2 people in the room. Nobody showed up, and that's just what it is. It's just a drop-in center. So if they don't feel like they could be sitting there and say, well, I'm not interested. And so that's the difference between running a shelter where your stay in the shelter depends on your participation in the program versus a drop-in center where you can just come in and go. And so we are looking at reimagining what our drop-in centers will look like. And so we, as an agency, we are in the process of looking at what our drop-in centers should look like. Should it be the same as we're doing, or should we raise the bar a little bit for people to get their skin in the game? And so that's what we're doing right now.
I'll say that I got to see a card that was given at the end of September to the Unitarian Church of Palo Alto for thanking them for hosting for the month of September. And all of the participants in Hotel de Zinc had signed it. And they didn't just sign a thank you card. They all wrote like real, complete phrases of real appreciation. So I think that, those folks are motivated to participate. And our case managers are supported. They don't have to reinvent the wheel with job searches, each and every one of them. We have job developers agency-wide that have relationships like with IKEA in East Palo Alto, where IKEA is familiar with our case management, likes our case management, and feels trusting to help place our clients in jobs at that facility. So we have, relationships with businesses all up and down the peninsula, so our case managers don't have to, look from scratch.
And to be clear, these case managers are just for the people living in one of the 88 units?
No. There is an assigned case manager for residents who need. So the case management at Opportunity Center is not mandated. It's not mandatory. We offer it, and you can refuse it, because just like you living in your apartment complex and your manager comes and say, hey, you have to join case management, we have tenants' rights, so they don't have to, but we try to encourage people to participate in case management. And so anybody who signs up for case management is assigned one particular person that they see. There are about 44 people who have signed up to see case management, but not all of them are active. Some of them come when they need help, and there are some that come on a regular basis, and others would come once a while when they can pay their rent and like, hey, can you help me with this? And I'm like, oh. So
the case management's only open to people that are living at the Opportunity
no,
Center.
it's open to the drop-ins as well. Anybody who, yeah. So there's one person assigned to the residents. There's 3 other people who are assigned to drop-ins and Hotel de Zinc.
So the entire Opportunity Center is open to anyone living on the streets, except for to live there, you have to have some sort of income.
Correct.
Okay. And then the rest of the people living on streets have to go to one of the churches that are offering the shelters.
Correct.
But Philip, didn't you say that it was kind of a requirement of staying in, like, say, the Atherton apartments, that you had to comply with seeing your case manager and working with?
Yes. So
explain that.
Yes. So when you live in one of our permanent supportive housing like the Atherton Court, it comes with case management. You have to have a case manager. But then again, it's no different from we ask coming to knock on the client's door. We'd have an appointment with them to come see them. We knock on their door, and they're never there. Mm-hmm. And so everybody is assigned one, but we try to follow up with case management and make sure that folks are all there. So everybody has a case manager, but we have to do a better job of making sure that these guys are actually actively participating in case management. The sad thing is, once people go into housing, they tend to forget what led them into homelessness, and the support and all that, and they think that they can do it by themselves. And so it takes one episode of something to happen before they come back and said, oh, I got to go see my case manager because I thought I was ready, or I thought I could do this on my own, but I can't. And so they call and like, oh, I want to do this. And so we put them back on there. So we do have people who go into housing and they're like, adios. But eventually we work hard, especially during the holidays when they know that there are going to be goodies and a lot of things coming in. Then we establish the trust again and try to work with them. But as a rule for me, generally, as long as they're staying housed, they're not getting into trouble, they're paying their rent on time, if they even stop by to say, hey, I just want you to know I'm fine, that's good enough. I think that has achieved what we're doing, is to keep people housed.
So, only because I'm trying to understand a little better. So, I before when you were saying you were distinguishing, as I understood, the ones who come into the drop-in center and then they don't have no incentive to follow through if they don't want to.
Mm-hmm.
And then the ones who there is more incentive because they're in the housing. That's what, nothing is forced on the people who are in the housing. It's just that they have this extra opportunity and you can follow up more if they're...
That's correct. That's
But
correct.
there's the middle piece of transitional housing, that you're there as a guest.
No, she's talking about the opportunity center.
True.
Yeah.
Well,
But
except
outside
when-
of the opportunity center is, I think that's why we're trying to look at what's the best model with that particular place, because it doesn't necessarily align with our beyond the bed model that we're using throughout both counties.
So that, I think you're seeing what I'm saying too. So then there's the transitional housing, like the Atherton one, and that one there's more of this incentive to work with your case manager.
Or Haven House in Menlo
Haven.
Park.
Because
there's
then
a
maybe you
big
can
difference.
Yes. So
There's a big difference
Yes.
because there's programming and it's all day long and into the night, and you're there as a guest, and it's kind of an old school way of looking at it, and I think that's because Dr. Greenberg, who's our VP of Program Services, he comes from a drug and alcohol treatment background, and so for those clients, having a set of expectations, assumptions, incentives is effective, and so that. I think that there's a lot of programming based around that.
My little, I don't know if this is helpful, but my anecdote is that I've seen many clients who are in sober living environments in San Jose, and they're, let us just say as an example, bipolar. And they're horrible. Many of the places are just, I believe, are very difficult to live in. So I can see that one of the extra incentives in this is that they're nice. So you would want, if you've got an issue where there's not much incentive, there would be more of an issue if the place is nice.
Yeah. So that is true. Yeah, that is true
beautiful.
for our transitional housing units and also the permanent supportive housing, like the opportunity center. Folks just like living there. So.
Well, you'll be glad to know that one of our later agenda items is looking at site visits for all our HISREP recipients, and you are on our list. And then there's some
Wonderful.
commissioners who've signed up, so you'll be hearing from us.
Wonderful.
And thank you so much for taking
Thank
the time to
you.
come and present.
Thank you so
really,
much.
this is a complicated issue, and it really helped to clarify so many things. to
No,
hear this from
really
you.
And thanks for the great work you do every day.
Yes.
So.
That's
Yes, and
Philip's staff is doing it. Thank you.
I came late. How long have you worked there?
I've worked with Envision Shelter Network for, I think I'm on my 12th year. I used to be with the Urban Ministry and then became Envision, and now I was one of
Keep
the folks
evolving.
at the Red Cross.
Yes.
Yeah.
For over 12 years, many, many years.
Yes, I've been around for a while.
And we're glad.
Thank
Thank
you
you.
both.
Thank you, Bill. Thank you, Mila.
Nice to meet you.
All right, so I hope the people in charge of compiling all this information took lots of good notes. All right, so next item on our agenda is to follow up on our discussion on Made into America. We heard from Elliot Margulies at our last meeting, and we'd all committed to putting our own family story on. So Commissioner Bicchetti, could you lead that discussion?
Thank you. I did talk to Elliot about what he might provide in terms of advice to get everybody feeling that this was not an overwhelming task. And matter of fact, it could be fun and fairly easy. And I think everybody got a copy today of his response to me. Is that right? You all recognize having received that? Well, that's what he told me, and rather than simply repeat what he told me, it's there in writing, and I think it makes a lot of sense. If you haven't looked at the website, you ought to do that, because it's pretty easy to see how, with a modest investment of time and a little thinking about what, among the many stories any of us has about how our family came to America, with a little thought of that, I think any of us can put together a nice story, and you might even have some photos to go with it. And so if you need help, if starting out by following the tips that are there on the website doesn't do it for you, he would be glad to help in other ways. And he is, as I think he told us, he's getting some high school kids to be scribes. If anyone wants to just talk to a high school student who's willing to write down what you say for your editing, then that could be posted. So we're talking 6 to 8 paragraphs, not a lot. And I think when you look at that website, you'll find there's a lot of interesting stuff on there, and you can be part of it. So I hope each of us will do that. I've already done it. I don't know if anybody else already done it.
I had to, but I haven't done it. I felt like a total failure, so I'm happy.
Okay. Well, this is a world of second chances, so you get a second chance, and you may even get a third chance. But let's say you only need a second chance.
So are there any questions or comments about the Made into America project? Anything anybody wants to discuss? All right, well, thank you for that update, Commissioner Bicchetti, and I hope we'll all take that second chance to get on that website. Everyone knows the website, knows how to get there, and answer the 7 questions? Okay, that's great.
Just Google Made into America.
Google Made into America, it's very easy. Okay.
May I add one thing? I suppose I told you about it last time, but it's just so exciting. So I went to I went to a guided autobiography class, and so I have, if anyone would like, 24 questions to ask yourself that would result in fascinating answers, I'm sure. So
Great. All right, well, now let's move on to our next agenda item, which is we're going to debrief on our joint session with the City Council, which was on Monday. I thought it went very well. I was very nervous when we started, but I think the council was interested in what we had to say and impressed by some of the accomplishments we had, and I just would welcome any comments or feedback from commissioners. In addition, we got some suggestions from different council members on things that we might want to do going forward, and I just wondered what jumped out at you, what we might want to develop further along with city staff.
Well, I'm just, do they have a copy of the buddy list? Because they did seem interested in getting together with buddies and weren't aware that they even had buddies.
Yeah, I'd asked Minka to follow up on that, and I don't know if she had a chance to do that before this meeting.
Right, we haven't listed the buddies. We thought, Amy and I were just curious, though, after that after that night, I know that some of you have buddies that haven't responded, and then there were some council members that were desperately seeking a buddy. So I'm just wondering, you know, we have a list if everybody just wanted to keep who they had. That would be fine, or if you'd like to change your buddy, we can write it down here. I think everybody's up for grabs except for the mayor and vice mayor, which are with the chair and the vice chair. But if you want to just tell me, I'm with, you're with Councilmember Price. So if you just want to stay with her, that's fine. But if others want to say, I want to stay with my council member, I want to change.
Well, I volunteered at the meeting to be a buddy with Mark Berman because it was so sad being lonely.
And
it's a bromance.
Commissioner Moran.
I think last time I signed up for Pat Burke.
Bert?
Bert, see, there I need to meet him.
Okay, so you want to stay with him. Okay, and
Well, I think I was with Larry Klein.
That's right.
Who wasn't there the other night, but I'm fine with him.
Okay.
And then was Teresa matched up with someone?
Yes, I believe she was with Liz Niz. because
Okay.
you, everyone assumed you wanted to be with her, and you kindly said no, but we can double check with her
Okay.
if she wants to stay with her. So we have that, so before I sent it, I just wanted to ask those questions, because I knew someone wanted to go with Councilmember Berman, since he was so enthusiastic about that. So we do have that, so I was just waiting for tonight.
Okay, so then, so Minka, can you follow up then with the city council with
I
our
certainly
list? Okay, and so I think we will hopefully reinvigorate the buddy program, and thank you so much, Commissioner Savage, for bringing that up.
When you're following up, could you also follow up why our liaison doesn't come to our meetings?
That would be Liz, I think.
Our liaison being Liz Ness.
Yeah.
She's in New York this week.
Okay, well, this isn't the only week she hasn't been
No.
here.
Well, I'm just letting you know this week.
Well, if you could
I
work,
can try.
you could work through the mayor or somebody.
I will do my best, Vice Chair.
Okay, I'm not sure we should put Minka on the hot seat, but maybe she's used to the warmth. I don't know.
After the last couple of weeks, I am.
And clearly, there's no reason why we can't connect with some of these council members individually, right? Say, I mean, I noticed, for example, that Karen Holman, who is so nice.
They're all very nice.
Yeah, but she was here and she doesn't have a buddy, so maybe she needs to be contacted as well.
Well,
Correct?
the other thing is there's a numbers discrepancy. There's 9 of them and 7 of us.
That's what I mean.
So someone could potentially, if someone felt like they wanted to have multiple buddies, I think that would be perfectly fine.
I would like, I'd like Karen.
Oh, wait,
Holman.
put your
As
turn.
well.
Yes, please, add me for Karen Holman. Thank you.
I think she'd be delighted. And I don't think, nobody has Greg Schmidt, I think.
Correct.
So I don't know if someone would want to buddy up with him as well.
He's a real supporter of human services.
He is a big supporter of his rep.
I'll take him.
Okay. Great, thank you. Thank you
Maybe
both.
the city council could narrow itself down to 7 and we'd have a good.
They have been talking about cutting themselves
and the
down.
meetings wouldn't last as long.
Yeah, that's true. All right, so thank you so much, staff, for helping us with that, and thank you for commissioners for volunteering to have multiple buddies. And hopefully we'll get some good traction on that. So the next item on our agenda,
Yeah, we're still
oh, wait, no, we're still debriefing on the, sorry, we got distracted on the joint session with our city council. So I was struck by a suggestion from Greg Schmidt about maybe reporting more often to the council. And I don't relish the idea of writing up like an annual or semi-annual report, because that just sounds awful and boring and not something that I personally would want to do. But I feel like we're out of touch with council for too long, and then we pop up every year or two and, you know, try to get more funding for this or funding for that. And I'd like to have a better ongoing relationship with them, either at the subcommittee level or at the full council level. So I was wondering about maybe every quarter doing some kind of touch base with them, whether that would be updating them on, like, say, a new HISRAP program or some need that we found out about that we think they should know about, so that everything's not a big surprise every couple of years and we have to start over again from the beginning, that they've been hearing from us on an ongoing basis, and so they're ready and primed for when we go and approach them about serious issues
I think
in the
if we really
community.
follow up on our buddies, that would be a great way of keeping them informed on a regular basis.
You know, maybe one thing would be for us to look on a regular basis to what's on their agenda, you know, and see if there is a relevant topic, and then there would be a good opportunity or good excuse to communicate with our buddies. Provided we have something to say on the topic, you know. But I'm sure, you know, we could certainly, from time to time, probably at least once a quarter, find something that's somewhat relevant to what we do.
Yes, I agree. Well, I like the idea of having more contact with our buddies, but I also like the idea of the HRC more on an official level approaching either the council or a subcommittee of the council, because I think we need to start getting more visibility around what we do, and it shouldn't all be informal discussions over coffee. I think some of it does need to be a little more formal and public.
Actually, I was intrigued by 2 of the ideas that came forward, and obviously it's up to the HRC to decide, and one I think you discussed earlier, but I'll just bring it up again and use the word report. And I think it could be something that doesn't seem as daunting. I've been struck lately, especially because of my director, Greg Betts, because he attends a lot of the executive management team meetings and he goes to a lot of the council members. At this council, the attention to detail, he was at a meeting the other night for the 1% for public art, and some of the council members were saying, I have something I'd like to discuss with you on page 132. Well, who knew after council night, the next night they were reading a page 132 of a report. So it's up to you, but I'm struck by the idea of maybe, you know, once a year having your study session, and then just once a year sending an informational report to the council. I really don't think it's something that they don't read and just say, this is what we've worked on, these are the things we're interested in, these are things we notice in the community, wanted to let you know. Because I think there's this feeling by the HRC that those kind of reports just go into the ether and they don't go anywhere, but I'm struck that this council is reading them. So I was intrigued by that idea. I was also intrigued by the idea that the HRC designate the chair or the vice chair to have the authority to go to council during public comment time if there are issues from the community that you are hearing that you'd like to bring to the council's attention and offer the HRC's help. Sometimes there's not always that time to have an HRC meeting. So I was intrigued by that idea because that would, you know, authorize the chair or vice chair on whatever basis you would see fit to go during public comment time to have, say, you know, I've heard these issues in the community, just wanted to let you know the HRC is here. So I just wanted to restate those two things that I heard, and it's just up to the HRC if that's something that they're interested in doing, but I was intrigued by both of those ideas.
May I ask, I have two points here. One of them is, what do you mean, I'm speaking procedurally now, that they would be there as public commenters, you know, the 3 minutes, or are we saying, or one of them be there to say, I am here, can you do that? I would like to respond.
It would be during public comment time.
So a 3 minute public, yeah,
That would
okay.
be, they would have, if they were speaking on behalf of the HRC, they would have to be authorized by the HRC. And at that point, I would just see it as an offer for help, an offer to assist the council, not their personal opinion about the item or anything like that. But this is what we've heard, and like I said, that's up to you all to deliberate amongst yourselves.
So you just, in fact, responded to the question I had, because I think it's a very good idea, and I was wondering, you know, how they could represent the HRC. But if it's just to offer help, then I think there is no question about the validity of that. I mean, it would be more tricky if it was on controversial issues, and then we have not voted, and it would be difficult for anybody to represent the HRC in that way. But if it's to say, you know, this is a topic that seems to be relevant for the HRC and would like to help, I mean, I would be willing to vote right now to authorize our chair or vice chair to be able to do that.
Why don't we finish reviewing our feedback from the meeting, and we could.
Okay.
And the second thing I want to say regarding the first point, which was the report to the councils maybe every 6 months or so, once in person and one with maybe a brief report. I think it might be a good idea. We should think about it. 6 months from now, we might want to send them one page, you know, on what we have been working on and some of the issues we see.
Can I add to that? Yes. Which is what I marked down in my notes, which somewhat, as I recall, Bert, seeming quite excited about these learning series, and I thought, you know, how wonderful they are. And so part of the reporting might be that information. I mean, which is not that difficult if you're just compiling it. Would that make sense or not?
That kind of information, the council gets a weekly report about items happening in the city that may be of interest to them. So that could just be, given to the council on a more regular basis. It wouldn't be a special communication that we would have to do to them. So if there's things that you are doing that you feel that are interest to the council, it could be included in that weekly email that they get.
Okay.
How does that happen?
I send it to the clerk's office and it gets in their email.
Which
Do you
means
write the whole memo
Oh, it's
of what
just-
the events are?
No, it's just like a little 3 or 4 lines about whatever we're trying to tell them about, whatever type of event.
so, may I ask you, so it would be like, oh, the HRC is having a wonderful talk about, from Philip. So, yeah.
A couple of other things. Lizness suggested something I found interesting and maybe very valid, which is to see if we could work a bit more closely with a county and with Joe Simison. I don't know exactly how we would do that, but it's something to think about, because I think it's a good suggestion.
Yeah, I agree, and especially in light of some of the things we learned tonight about, the utter lack of a family emergency shelter is really appalling, and there are some issues that I think we should follow up with the county on. And I think Liz Niss also mentioned that the vast majority of county resources are concentrated in San Jose, and very little of it makes its way north to Palo Alto. To get any piece of that pie, we're just going to have to really, really rant, rave, tear our sleeves, and make a fuss, and get our superintendent, which is our supervisor, which is Joe Simidian, on our side. But we're going to have to. We can't just generally rave about the iniquity of it all. We're going to have to, come up with some specific issues that we're really concerned about, and give him some specific direction on what we need to have happen in terms of getting funding pushed northward.
So an idea is maybe when we go and visit some of the agencies, or when we do an update to community services needs assessments, we might want to think about the county and not just Palo Alto, and ask them what issues they have with the county, what's missing, and take some notes on that. So then we could compile all that, and then maybe discuss that with Josie Mission at a later date.
Okay.
We could also extend an invitation for Joe Simidian to come and speak to us at a meeting, just giving us an update on the county, and just give and take and see where that leads us.
Yeah, that's a great idea. I wonder if we can get a hold of him. Well, I know how to get a hold of his aide, so maybe we can get a hold of him.
I was going to say, yeah, or we can add, I'm not sure if Patty DeMelopine is still his chief aide, but we can see if we can get him or a chief aide.
Okay. All right, so let's circle back a little bit. So I think the idea of...
That's it, what
Oh, I'm sorry. Wait, did you have more to say?
Yeah.
Say
Have they said anything yet?
it.
I think this was a very interesting meeting, and that the council members did not argue with each other about it. They all seemed to have their own way of thinking that the HRC could be helpful. So I think we got a lot of what we wanted in terms of their interest. And Liz did say about being more aggressive with the county. I think we don't want to go off half-cocked on that, because there's a lot of people who are working on how to get the county interested in various things. And so I think we need to be alert to those connections, particularly since we're involved in a lot of that, like the Housing Task Force. I think that Bert's idea about paying attention to items and noticing where there are ways that we could be involved is something we ought to take seriously. And I like the notion of 3-minute comments at the public comment section, where we might call attention to something that we think where there's a human relations implication and not just a city management implication, and offer to be of assistance. I think Greg Schmidt's 4 points that he made were very interesting. I'm not sure what we can do with a lot of them, because he commented about the providing an overview of nonprofit services in Palo Alto, and Gail Price said something similar on the grounds that the city's not a service provider, and so she sees the HRC as a possibility of being a sort of coordinator of information about services, so that there'd be some way to communicate either from the service providers to the council and from the council to the service providers in ways that raise the level of service providers in the picture of the city and how it gets its business done. There were a couple of requests for ways that the HRC might inform the council of how the community is shifting, changing. She commented that she was surprised to learn from our Human Services Needs Assessment how of the low income levels in the community. She said that was news to her. And she said she'd like the HRC to help describe in strategic form what's significant in the city regarding human relations. I think that's an opportunity we shouldn't pass up. And there was one other suggestion by Councilmember Schmid that we pay attention to the housing element of the comprehensive plan and provide human relations oriented commentary to that. And I'd love for us to figure out how we can be a kind of working partner as that element in the comprehensive plan keeps being looked at. He also said something about an annual city survey that we could help assess the results of for the council's benefit. And I don't know whether he was talking about the SEA report or something else.
I'm not sure. Let me listen again. I did listen to most of the study session right before I came to this meeting, but I must have...
Yeah, I think I'm quoting him. That's his term, annual city survey.
Yeah, I would think that's the SEA report.
I would think so too. And
that's service, efforts, and accomplishments for folks.
And there's lots of interesting information in that. I mean, a ton of interesting information. And we might help by studying it and pulling out the things that have human relations implications.
And I know, just to interject, that when Renee, our intern, a couple of years ago did the needs assessment, I did have her look at the SEA report for a couple of years, but we haven't done that.
Do you know it's done yearly? Is it correct?
It is. We are in the process of submitting information as staff right now, so I'm hoping I can check on the timeline. I just pay more attention.
It usually comes out in January.
Yeah.
And what about the housing element? How often is it revised?
I believe it's every, I don't know. I know the comp plan, I believe, is every 10 years. I'm not sure what the requirement for the housing element. I have been in touch with Tim Wong, the affordable housing planner, and he has extended an invitation for the HRC. Let me look at my notes again. Let's see. He can explain the housing element, and he thinks, yeah, I cannot think of, let's see. The HRC can look at the policy and programs for the transportation element, and I'm sure that they could do the same for the housing element as well. So I think for the transportation, I know the feedback that felt a little just cursory as far as the HRC's involvement, but we can definitely be in dialogue with Tim to see if the HRC can be involved in the housing element in a more significant way. Then it's just not like equated to like members of the public giving comment, but there's a little more weight given to the HRC's comment. So I'll be in dialogue with him, and he was going to be one of my suggestions to actually come back and talk about ABAG and state housing mandates. I had to leave during his presentation, and I'm not sure that he did talk about ABAG and state housing mandates. So we may have him come back at another time and very specifically let him know how the HRC would like to be involved in the housing element.
Well, we certainly have a kind of self-imposed obligation to make something out of this learning series that we've been having, and that could feed naturally into the housing element in respect to low-income housing. My takeaway from the meeting was that we really did get our point across, that the HRC has too low a profile and we need to be more part of the foreground and less of the background. And it reminds one of, be careful what you wish for. So I think we have lots of opportunities to be heard, and we need to take these opportunities and be systematic about them over the next year.
So I'd like to make a motion that we authorize our chair and vice chair to address the city council to offer HRC services when they see it as a possibility that would make sense.
I'll second the motion.
Do either of you want to speak to your motion?
No, I think, no, I won't speak more. I think we've discussed it enough. I think we know what he means.
All right. Are we ready to vote?
Yep.
All right. All those in favor of authorizing the chair and vice chair?
Aye.
And opposed, abstain? We are so authorized.
And if the city council likes what we say, we'll see if we can get them to double our pay.
That's a good idea. A very good idea. Although twice nothing is still nothing, as my father used to say.
I've heard that.
Okay, and then so we want to leave it to our wonderful Minka to follow up on our involvement in the housing element for the comp plan. And then what about the kind of semi-annual report? We'll have our once-a-year study session in person, and then probably 6 months later we should, if we're going to do it, we're going to have to write up either a PowerPoint or an informational report. Do we want to have people on a subcommittee who volunteer to do that? How do we want to go about doing that?
I think should be personally, the chair and vice chair with the help of staff drafting just a 1-2 page memo, not much more,
Okay. Any other thoughts?
I'd like to see us take a look at the SEA report when it comes out and see if it can't be a kind of pivot around which to make some comments about issues in the city and results in the city and descriptive statistics about the city that might warrant some human relations
Okay.
exploration.
Well, I think that timing would work out because we just met with council, so November, December, January, February, March. So March-ish, we would be doing our semi-annual report back to them, and the SEA would have been out for a couple of months, so we'll have had time to analyze it and take a look. And perhaps by then we might have some results from our own supplemental needs assessment and having talked to our HISRAP recipients by then. So if we can have some good information to follow through with council on.
What, again, is the SEA? It comes out once a year, and services, efforts, and accomplishments. It's just a wrap-up?
It's an annual survey.
And who puts it out?
The city auditor's office compiles and puts out the information. So we're trying to work on it that it's a little, not just facts, but it's also stories about what the city has accomplished in different areas as well.
You can get a copy of it. It's on the 7th floor upstairs. One more.
It's online as well.
Oh, it is?
It is, at least the last one.
One more thing about all of this. We have to figure out how we're going to capture what we're learning from the housing series. And I don't know, I've got my own notes, and I don't know what Minka and Amy are putting together, and some of the rest of you might have some notes, but we need to capture that and make as much out of it as possible in terms of usable comment and commentary about what we've learned and what we think the city can learn from our exploration.
Well, I think that actually feeds into our next agenda item because there's a subcommittee that's already volunteered to do that work. And so I think that group is going to need to get together and figure out an action plan from there. So is there any more debrief on our study session with the City Council before we move on? All right, well, let's move on then, which is, again, very timely because Ray just brought this up. How do we follow up on the projects and priorities we identified at the retreat and the different subcommittees that we formed at that time? So Minka's going to explain that process to us.
Right, so you asked me to look into that, and I started to work on that, and I started to put next steps and all these other things. And then I really came away with a series of exact next steps for all of them that I'd kind of like to go over with you. One is, I think.
Well, first, Minka, could you remind everybody which subcommittee they're on?
Yes, I can hand this piece of paper out. I think there's more because they're for members of the public if they would like one as well. Okay, so what you have in front of you, yes, I still have my own copy, is a listing of the priorities. So, but what I do want to say is that's just part of it. You could give one to
Mila.
To Mila as well.
Our public, yes, thank you.
What I did is I took the priorities from our last meeting and I took them from our very first meeting and I took the slides that you did for the meeting with the council members as well. And most of them were exactly the same, except some of them still had some projects that were listed on an initial list, which weren't reflected on the last list. And I know at our last commission meeting, there were a couple sheets that were floating around. So on the priorities that I still had some questions about, if there wasn't complete clarity on the projects underneath the focus area, I left those on here. But my feeling is that we should follow the following priority. First, we need to get final agreement on their priorities. My feeling is that each of these groups had 2 or 3 commissioners that were interested in working on it. I feel like each of the subcommittees should meet and that they should come up, for lack of better phrasing, with a work plan and a timeline for what is feasible to complete during this year. And we might just leave it, if some of these projects that I wasn't sure if they had been finalized, we might leave it for those subcommittees to consider. And then my suggestion is each of these subcommittees identify a lead commissioner to schedule and set up the meetings of their subcommittee. And then we set a date for when we'd like these subcommittees to come back and return to the full HRC with their work plans for the full HRC to comment on. And again, that would be what they're working on and the timeline. And then those subcommittees would start working. So that's what my suggestion is. Individual meetings, work plans, timelines, bring it back to the big group, and those subcommittees start work. But I think it's important for each of the subcommittees to identify a lead person that could contact their fellow subcommittee members to schedule meetings. Maybe one of them decides to be the scribe and get it back to the full group.
Okay,
and
so
if you want to run your ideas past me before it comes back to the full HRC, that's fine. If you don't want to and just want to compile it and bring it back to the meeting, that's fine as well.
okay, so Minka, you're saying that so staff doesn't need to be involved in the subcommittee meetings. Okay.
It's staff. You know, in other commissions, sometimes they are involved in some committees, but subcommittees, but most often. On the commissions, the subcommittees just run pretty independently of the staff, so staff doesn't need to be involved.
Okay. Okay, great. So any questions or comments on this process or on the subcommittees themselves? So,
we'll need to look at
so is there a problem?
No.
Okay.
So should we ask each subgroup to separately meet and name a leader, or do we do it here? Or what?
Well, I was wondering, could we maybe looking at the groups that we signed up to be part of, agree that who might be the lead for each of these subcommittees, and then everyone will know kind of who's going to be organizing the meeting. So I'd be happy to take the lead on HISRAP funding, which would be me, Claude, and Greer. And sometime in the next couple of weeks, then we'll convene and go through and start planning, writing out our work plan and a timeline.
There is one aspect where we might have to involve staff as for simplification or streamlining of a HISRAP application process.
Yeah,
Because
I
we don't,
certainly-
you would not want us to do it from scratch, right?
And I certainly think that I think once you come up with a work plan, and then I can give comment on, that's something staff will do for you, or that's something staff, I don't want to like totally pull back and say I will not be a resource for you, or I will not provide information for you as well. But there's certainly aspects where staff will be involved, and Amy and I will serve as a resource as well. So yes.
Okay. And so I'll be the lead on that one. And then Ray, I don't know, are you willing to be the lead on the affordable housing?
Yeah.
Okay. So you'll contact Teresa and make some plans to meet with her. Okay, the next subcommittee group is Ray, Daryl, and Dion. So one of you want to step up and be the lead there?
Would you like to be the lead?
Would you?
No, I'll be happy to. It's just I thought maybe you want to. Okay.
Feel free.
Okay, so Daryl, you're going to take the lead on that one? Great.
If it could be helpful, I mean, I can give a template for the work plan.
That would be
and
helpful.
that would be, I can do that.
Can we co? That's not a bad idea.
And then I think also, let's just touch base on our strategic relationships. Some of us, I think, are already in place, but I want to make sure everybody knows how to play the role that they've agreed to assume. So Greer, are you comfortable with Project Safety Net? Do you know how to get in touch with those folks or get on their meeting list? Or
Yep, more into a few meetings.
Okay, so he's good to go.
He's going.
Okay, so Dion, do you know how to get in touch with Santa Clara County HRC and get onto their subcommittees and attend their meetings?
If I don't, I will ask.
Okay, great. All right, and then the police department, Daryl, I know you've been working with them for a long time, and Claude and Dion, and well, Claude, you have too, right?
Yeah, and we met with the police chief a couple of days ago. So.
Okay, and Dion, you're good there too?
Good.
Okay. And then the Palo Alto mediation program, Greer, I know I introduced you virtually to Jill Barsley, so are you good there? Are you on their list? And
Yeah, I'm on the list. I haven't been to a meeting yet. But
okay, all right. And Dion also?
Yeah.
Or do you, okay. And then the Homeless Services Task Force, Ray, you're already knee-deep in that, and then...
Greer and I were at their meeting yesterday.
Okay, all right, great. And then, then Teresa, actually, I really wanted to ask her about connecting with immigrants in the community, but she's gone.
Can I add? I want to add to that. I thought she was still here. She's left.
She had to leave, yeah.
So I want to join her on that one as well.
Oh,
That's
okay.
Yeah, as opposed to making it a one person.
Okay,
So she's the lead, and I will be on it as well.
okay. But Teresa, that is a very kind of undefined role. Someone is going to need to really help, I think, Teresa figure out how to make inroads in what types of activities to undertake, whether she should do a survey or she should go to a Chinese church. And I mean, I'm not sure exactly how she wants to get started.
Perhaps this is something that the full HRC can have as an agenda item to flesh this out, because I was thinking as well, that's the only one that's a little amorphous, that could be a lot of different things, and maybe it would be helpful to do some framing of that to see what maybe Commissioner Chen and Commissioner Moran's strengths are, or get some ideas of need.
Okay. All right, and I think they may need some staff time with you, Minka, just to maybe get them started?
Well, that's a question. If you want me to meet and frame it with them, or is that something you want as a full HRC to meet together and frame?
Well, I'll email Teresa and kind of find out what she'd be comfortable with. But
Okay.
I think when I talk to her, she really wants to take it on, but she's not sure how to get started.
Right.
So,
And I'm happy to open the doors that I know how to open. But I think since it's such a large area, I think it would be helpful to do some framing, so in a way that she has her own, work plan for what she's going to
Okay.
do, because then it's easier to measure some results in the end.
okay. All right, so I'll reach out to Teresa and we'll figure out what will be most helpful to her and then go, and then.
And,
you-
and the
then you-
options are, can I be clear, are to either meet first with you or to meet with the group as a whole?
Well, let me ask Teresa kind of where she is with this process
Yeah,
and,
my,
And we
because
can
my
discuss it at
intuition-
agenda planning.
yeah.
Yeah, my intuition is that she would probably want to meet with Minka first.
Oh,
For
no.
what it's
I
worth.
just remember she was a little bit blank on how to
Yeah.
get started, so I'll just see what would work for her. All right, well, I'm very impressed. I think that we're already got the wheels turning. We're good there. Anything else on this topic, Minka?
Chair Nan, did you want to send a deadline for when you'd like the groups to present their work plans to the full HRC or an update? Did you have some ideas on that?
Well, I'm hoping that all the groups will meet sometime before our next meeting.
Okay.
And then have a work plan by the end of the year, by our December meeting.
Okay, thank you.
I mean, in an ideal world. Okay, so any other questions or comments about getting started with our HRC priorities? Everybody's good? Knows what they're supposed to do? Okay, great. All right, so now we're going to have an update on our HISRAP site visits. So as you know, we have, I think, 16 agencies now that are HISRAP recipients, and occasionally we like to visit them. We like to do it in a year where funding is not up for renewal, so that we can stay impartial. And we had already done a preliminary list where people had signed up, and is that what we're passing around now?
That's correct. Commissioner Savage was absent at the meeting that we did this, so I was just handing it to her.
Oh, okay.
Can I comment briefly on that? You know, which I know that some of you have been to these. I have not, you know. And so I'm interested, this is the kind of thing that I'm very interested in, which is to go and just actually see what's occurring. So any opportunity I would have to go to any one of these 16 places, I'm interested in, for the record. And I'm assuming that would be true of my fellow Commissioner Stone, for example.
Oh, it would. It's the ones that I've been to in the past have been very informative, and you really get a sense of the agency that you just don't get on a piece of paper when they hand in their proposals. So I think it's really, really helpful to do this work. So what we want to do, though, is not have several people approach the same agency and each one come on a separate individual visit, because that's, disruptive to their time too. So we'd like for people to kind of clump together in small groups and sally forth and try to visit at least 2 or 3 agencies sometime in the next, say, 6 months. And just, I think it's good to check in. So everybody, it looks like everyone had signed up for some of the agencies.
I do have a question.
Yes?
If I may, which is that the clumping, given our calendars, is difficult. So how do you envision that happening? Meaning that, just in terms of...
Well, one person has signed up to be the lead commissioner on that.
Okay.
So that person will reach out to the agency and probably come up with a couple of dates that work for the agency. And then get in touch with the other people who are signed up to visit that same agency and say, here are the date options, and hopefully people can rearrange their schedules and go. And if not, then there may be some opportunities you have to forego.
And my suggestion would be that a third step would be to, through staff, let everybody else know, because some people might say, oh, I might be available, and you see what I mean? There might be only 3 people who sign up, but there might be more who might be interested in seeing the agency if they know the date.
I think that would be helpful. Once a date is confirmed, someone has reached out.
To everybody.
Then, maybe we should we'll have staff help us copy everyone. And then if you decide, even if you didn't originally sign up, but if that's a good time for you and you do want to attend to that agency, you can go. That would be fine.
I mean, I don't want to be...
Because the maximum would only be 7 people ever, so I don't think that'd be too big of a crowd.
So I don't have to sign up for these because we will get
Well, sign up to take the lead on at least one so that you're the person making the arrangement.
All right, already done that.
And then we'll copy, once things are confirmed, we'll copy everybody, and you'll have another opportunity to kind of piggyback on a meeting. Especially if your meeting fell through, you couldn't get the date that you wanted or you weren't available, maybe you can piggyback on something else. That way, hopefully everyone will have a chance to go at least a couple of times and see at least 2 different agencies.
Is that sheet going to be available to all of us?
Yes.
It certainly will. Once now that it's filled out, I will send it out to everybody.
Okay, and then if you're the lead, that means you're in charge of reaching out to that agency and explaining that you're from the HRC and you want to bring your group to visit, and then come up with a couple of dates and then let the rest of the team know. Or I guess, we might have to do this through Minka, though, right, of the Brown Act? If we have dates and we want to let the rest of the HRC know, or is it just the other couple of people who signed up?
That's what we're looking at that very distinction right now in the Brown Act, if it can only be the three, or because this is not a venue where you would be
Still,
discussing.
in the
business.
past, it's always been limited to 3.
Right.
Yeah.
So that's my initial.
Yeah.
That's been my modus operandum for it, but we were just looking at something right now. So
So now I'm asking for clarity, which is that we're talking about 2 separate things, aren't we? Are we talking about something having to do with, could you explain that list, versus wanting to go as an HRC person to see these different venues?
well, it's my understanding that you're going to see these as part of these group visits. Am I not
All right,
understanding?
but now I'm
your
trying to get
question?
some clarity on 3 versus 7.
Well, it's our general understanding that you can't go with more than 3 people due to the Brown Act.
Okay.
But we're not
There is something in here
discussing-
about social or ceremonial events, so, we're having our class in the Brown Act in a week, and I think I'll just bring that up that night, and if there's anything different, then I will send it out to the whole group if you were able to do that, but I have the Brown Act and handbook in front of me, and there is an exception for social or ceremonial events, and this seems,
Social.
If you're going to ask the question of a lawyer, I can tell you what the answer will be. Don't go over 3,
I know,
because there's money involved and people might complain and so on.
right, and that's my general thing. I'm always tend to be a question asker, but, yeah, my general understanding, it would be the 3, but I will ask
When you
again.
guys put this
Commissioner
list
McKenney?
together,
Could you just explain that to me, which is that there's money involved in terms of that someone might object?
these are all HAZRAP recipients.
They're grantees of our funding
And if a
allocations.
quorum of the HRC goes to visit, this isn't a ceremonial or a social event. This is related to an allocation of funds by the city council. So if some other agency who didn't get 3, 4 visitors said, well, how come they got that and I didn't? That'd be an awkward question to answer in the
They would say,
context
oh,
of the
you
grant act.
visited their agency, and now next year they get more funding, and that's because you visited them and you didn't visit me, so
Got it.
you have to be careful.
Okay, so it sounds like we are limited to 3 for our visits, but nevertheless, let's post the date that we're going, and if for some reason there's only 2 people going and you want to piggyback and be the 3rd, you can be the 3rd. If one person's going, maybe you can piggyback and be the 2nd or the 3rd.
And I don't want to, if somebody, I've just taken that up just to make it clear that I'd like to go to these meetings, but if anybody else wants to go, don't hesitate to let me know. I'll figure out something else.
Can I make a request?
You certainly can.
When you reformat the sheet, could you put down the contact information and
Sure.
including the name of the person we should talk to at each of these agencies?
I would be happy to.
And could I ask when the Brown meeting is?
I'll pass this back to Minka.
That's going to be October 23rd at 6 o'clock in this room. Possibly in this room or in the chambers. You will get a reminder. There was a save the date a while back, but I'm assuming sometime next week the clerk's office will send a reminder out. But 10/23 at 6 o'clock.
And it's mandatory?
No, it's not. It's only if you feel you need to go.
Okay.
Especially important for
New
commissioners
people,
or new
especially.
So I've been to at least 3 of them already, so.
Then you're probably good.
I missed last year.
Okay, so any other questions or comments on our site visits? So we'll get a refreshed and revised list from staff,
You certainly will.
and then everyone who signed up to be the lead, please reach out and make that contact. Okay, so next item is reports from officials. Do we have any officials? Liz isn't here. Do we have any commissioner reports?
I have 2.
Okay.
First, on a Sunday, I went to a community event organized by American Muslim Voice. It was Meet Your Neighbor at Greer Park. Samina Sundas was a key organizer, the one who did the peace picnic, and didn't stay too long, but it was a very nice event, well attended. It seemed like very good thing. Great food.
Did you get to meet your neighbors?
Some of them, yes.
Good.
Including Pat Burt was there. And the second thing is yesterday, Daryl, Diane, and myself went to see Police Chief Burns. And I think it was a very interesting meeting. I think we had a very good meeting with him. Maybe you can add to it after I mentioned the key topics. We asked him to give us an update on the CAG, the Community Advisory Group. And he's looking at a few cities in California that have somewhat similar groups, and he's trying to get some more information to see how it's functioning. And he, I think, wants to most likely resume having some of his meetings in something like 6 months or so. And he might count on the HRC to maybe interview some of the candidates who might want to be on the CAG. So it's still tentative, but that's basically the idea. We discussed also staffing. We are still understaffed, but we are making good progress. We have like a pipeline of people in the academy coming online. So every month it's getting better and better. But I think it's still probably like 6 months away before it gets into pretty much normal. We are doing great with social media. We have like 5,000 likes on
the Palo Alto PD?
Yeah, Palo Alto
cool.
Police Department. We have 5,000 likes on.
I think that was 5,000 followers on Twitter.
Followers on Twitter and on Facebook. Look, Facebook. And so they are fairly active. We have followers even from Australia or other places. And we had a brief conversation on license plate readers and how it works with the county and how long the records are kept. We talk about community outreach. We talk about some of the spike in burglaries and robberies. We suggested that they advertise a bit more of the ride-alongs, because that's a very good tool for community outreach. Another important news is I think they are going to have a second school officer, because there is only one. Mm-hmm. So with 17 schools, that's not enough. Did I miss anything?
By that, did you mean the Citizens Police Academy that?
Oh, yes. No. Yes, I did mention that, yeah.
Yeah, well, he said that wasn't really public yet.
Oh, pardon.
Well, that's a great report. I'm glad you guys were all able to see him.
He said there was he said there was an officer that they've hired in social media who's extraordinary. It's an incredible honor to be part of the International Association of Chiefs of Police, and he's on that.
Oh, that was Zach Perone.
Yeah.
Great. All right, so any other reports from commissioners?
I have one.
Okay.
So then yesterday evening, I did what I love to do, which is, since I had read that Dennis Burns was going to introduce a writer who used to be a psychologist for 40 years, I think, right? 20 to 40 years, Ellen Hirschman. Anyway, she wrote a book. And so I went there, long story short, and I was really touched. There must have been 30 police officers all there, all supporting her. And it was good.
Great. So any other reports from commissioners? Any council buddy reports? Speaking of buddies, has anyone rounded theirs up? Not yet. All right, we'll get there. And our liaison reporter, okay, Liz isn't here. I never know, the reports from official things always confuse me. And staff liaison, Minka?
I was just going to report on the Brown Act class, but I
Okay.
already did that.
Okay, so everyone's good with the Brown Act class if they need to go?
And just to say that I went to council meeting on Monday night after we were here, and it was impressive to see our faithful leader here.
Yes, I think everybody heard that the council unanimously passed the $250,000 for
20.
case management, permanently housed 20 homeless people. So we are very proud of that on staff for that work and our relationship with the Homeless Services Task Force.
It's wonderful. All right, and so are there any tentative agenda items for next time?
Do you want some progress reports for these three committees and the priorities? You said you want them to meet by the next meeting, so it might be good to have each of them say what they decided when they met.
All right, that's a good point. So can we put reports from the subcommittee leads?
Progress report.
Pardon. Anything else?
Are we going to have another installment in the housing?
Yes, we are. And I think Minka's already looking at possible speakers for next time, but we can discuss
Right,
that.
I think I was going to see if Tim Wong would come back to talk about the housing element and state housing mandates and how the city is doing regarding that, or if there are other suggestions or other areas you'd like me to look into, I'm happy to do that as well.
Okay.
The housing element is published as a separate book. Can members of the HRC get copies of that?
I can look into that.
I don't know how many copies there are. I got one.
Do you want I mean, who would want hard copies and who would want soft copies?
I'm
Soft
sorry.
Housing
copies on a
element.
Computer.
What?
Soft copies meaning a computer
Yes,
site
sir.
where you can look it up.
Yes, sir.
Soft copy.
Soft copy?
Yeah.
Hard copy?
I'd go hard. They're always long.
3 hard, 4 soft. Well, everybody will get the soft copy as well. Okay.
Okay, so any other agenda items?
Did you want to try to reach Joe Simidian to see what his availability is to speak here?
Oh,
Do
yeah.
I think I'd work with the chair, because I'd like a very specific set of questions or something that I'd like him to be able to address if we invited him to our meeting. So maybe we can.
Yeah, we might want to have some people meet with him first to tell him what we've been up to,
Right.
so that he can figure out how to be useful to us rather than just hey, Joe, give us an overview of the county.
We have on the next month's agenda the topic of HISRAP and PAC and Avenidas, the request that the HRC explore taking them out of HISRAP and making them a just general services contractor. Our meeting with the Policy and Services Committee got pushed back till February. So but I still think it would be important that we start that discussion in November. So that would mean I would, prepare a staff report for your consideration.
So it's a request or a suggestion from Policy and Service Committee?
It was a request for Policy and Services, or I think actually it might have come, it actually came from the full council during the budget hearing.
Oh, okay.
That PAC and Avenidas be considered to be taken out of HISRAP.
Okay.
So yeah, we should begin that talk, because that could be a very lengthy and difficult discussion. And we may need to make that a 2 or 3-parter.
Yeah, we'd probably, if I need to do a staff report by February, I think it'd have to be
Done by
we could
December.
probably still would have to be finalizing your opinion at the January meeting, because right after that, I'd have to turn around a staff report.
Okay. So anything else that we need to talk about? Yes, Amy?
Oh, yes. That's why Amy's my partner here. To remind you of, you'll get another nice invitation, but that the commission recognition event is November 7th at Lucy Stern. I believe at 7 o'clock. You will get more information from the clerk's office, but wanted to remind you of that.
Okay, and just to make sure that Greer is on that list?
He should be from the clerk's office. Did you get a save the date from the clerk's office?
Yes.
Commissioner
Okay.
Stone? Okay.
Okay. All right. Well, if there's nothing else, then we are adjourned. Thank you all so
Good.
much.
And let's
10 Penn